Tough choices about the County Council's budget and savings proposals. East Sussex County Council planned to spend more than £370 million on services for East Sussex in the year from 1st of April 2018. This is guided by our priorities of keeping vulnerable people safe, helping people help themselves, growing the economy and making the very best use of resources. Our budget is made up of money we get from the council tax and from business rates, income that we generate and grants from the government, for example the community care budget. The grant that we get from government continues to get smaller even though need for our services is rising. This is why we have to make the budget balance, so that means making more savings. The coming year's budget proposals will reduce our annual spending by £17 million. It involves us proposing to raise council tax by 1% more than we had planned. We're proposing a rise of 2.99% in total, which would allow us to maintain more services for vulnerable people. That said, we know it will be difficult for many residents and will still mean reductions in much valued services. The financial challenges we face as a council are long-standing. We have made savings of £112 million since 2010. To give you an idea of the scale, that's enough money to provide care for 6,500 vulnerable adults or repair 2.6 million potholes. So, we're now at the point where our options are increasingly limited. We have urged government to urgently rethink the money it gives to East Sussex and to give our county a fairer deal. You may have seen the Stand Up for East Sussex campaign and petition, which was signed by nearly 6,000 people. As a department, adult social care needs to save nearly £10 million. This level of saving means that we won't be able to provide all the services we currently do. We are likely to have to stop or significantly reduce the money we spend on some services that we know prevent the need for more complex or long-term support. It's not just the people we support and our staff who will be affected. We are talking to people across health organisations and others about the knock-on effect that this will have on our increasingly integrated services. The savings proposals outlined in our Cabinet papers and in the public consultation are just that, proposals. The fact remains that we need to save £10 million overall in the department, so if not from one service, it will need to come from another. Our consultation is designed to help us better understand the risks and impact that the proposals will have and how we can make our savings in the best possible way. You can take part in lots of ways, in person, over the phone, in writing, online or in any way that best suits you. All of the results will be presented to the decision makers in June.